this course has been so terrific is his hard work. It's been a huge effort to keep us all in line. And between Randy and Josh, I think we owe them a lot of credit for really setting this up. And we've gotten so much good feedback. So, but Josh, why don't you tell us how you got interested in medicine?
Yeah, sure. So I went to undergrad at Washington University in St. Louis. I just graduated this year, and I am now applying to med school right now. I'm in the cycle. So for anyone who's deep into secondaries right now, I feel your pain, and that's what I'm going through. But for me, medicine has always been focused around serving underprivileged populations and also working with children. That's what I've done a lot in college. That's a lot of the clubs I've spent my time participating in. I worked with a club called Med Ed, where we would go to local elementary schools in the St. Louis area, and we would put on presentations for them just to get them interested in science, teach them some basic health care, because a lot of them just don't have that education and their parents aren't always around to help them with that. And we wanted them to become advocates for their own health. So that's really driven me into medicine, is just to serve these populations and to make a change there. I'm also been interested in research. I spent undergrad since freshman year working in a research lab, working on, we studied the extracellular matrix and proteins that played a role in angiogenesis and metastasis in breast cancer. So that's what I was doing there. In my free time, I like to read. I like to read a lot. I read a lot of fantasy books. So if anyone has good recommendations, I will take those.
You like the coladas?
What's that?
Long walk on the beach.
Long walks in the rain. What I mean, there was a question yesterday about obstacles. Were there times you question yourself?
Oh, absolutely. I mean, I think everyone at a certain time thinks that like they're not good enough. They look around the classroom and they're like, these kids are just smarter than me. But it's not the case. I've had struggles in classes. Freshman year was extremely difficult between starting in college and going from high school. I struggled. My grades weren't as good as I hoped they would be. But by the time I got to end of sophomore year, junior year, you figure it out. You know how to study better. You know what resources you need to get a hold of, going to the teachers, going to TAs, using your friends. The people around you are probably the best help you can find, the people that have went through it before you. And that's what got me through it.
I mean, I think there's been questions about this kind of imposter syndrome, and we all have, you know, we all get in there. I remember my first day in medical school in the clinics. I went in with a stethoscope around my neck, and I had my white coat on, and you know, you'd only been in the basic sciences, and I show up, and the patients think you're a doctor. They start asking you questions, and I was just like, this is nuts. I mean, but you know, the truth is, every transition, whether you're from high school to college, I mean, this fear of college and being a college freshman, and the transition to being, you know, away from your folks, and you know, buying your own groceries and doing your own laundry and stuff like that, and you know, you gradually, you know, accumulate a set of skills and independence. And it's no different I think, in becoming a physician or a surgeon for that matter. It's just, it goes longer and they're more interesting transitions. I remember my first IV I put in, my first, you know, lumbar puncture, you know, in some ways those were exciting as, you know, doing some of the surgeries we're doing now, and in a lot of ways more daunting. But what's the things that you've encountered that were maybe the things that you struggled with, and then you overcame those things, and you proved to yourself that you were made for this?
I mean, I would say the basic science classes are really, they make them to weed you out, they always say, and that's definitely true. I struggled a lot. I thought coming into college, I knew how to do biology. I'm going into science. I expected it to be a cakewalk for me. And I found very early on that it was not the case, that college is hard. I think a lot of people realize that. But I took that semester. I didn't do so well. It was my second semester freshman year where my grades were not great. I came out of that semester and talked to my parents. Was like, is medicine for me? Can I really handle this? And I got to school the next semester, started taking organic chemistry, had the same feeling because it's very difficult. But I got through it. I worked my butt off. I realized I needed to change my attitude and change my outlook and tell myself I could do it. Those obstacles were hard, but I learned an incredible amount from them, and I think I'm better because of it. And by the time I got to my junior and senior year, it was on autopilot at that point for me. I knew exactly what I wanted to do and how I needed to accomplish all of my classes, and I finished and was very happy with what I ended up with.
Josh, is this technically a year off for you then?
This is a year off for me.
And why'd you decide to do that?
I think that it seems that like it's very rushed, the whole process through college, going into med school. A lot of people like just go and just move as quickly as they possibly can. But I found that I wanted to get a good undergrad education. I wanted to make sure I'd taken all of my time to learn everything before I started taking the MCAT. I wanted to also have more clinical experience. Hopefully, that's why I wanted to get involved with your department as well, because I didn't have a ton of clinical experience as an undergrad. I did some shadowing with Dr. Chaliff at North Shore, and then that was like most of the shadowing I had done. And so I wanted to become more involved with patients and patient interaction. I spent a lot of time in research, but that was mostly wet lab research. That wasn't really patient interaction.
Yeah.
Yeah, I mean, I think, go ahead, Randy, I'm sorry.
Well, I agree. And, there's a lot of feedback coming in the chat too about the process being rushed. And so, I took an atypical path myself with a lot more time. And when I came back to it, when you're in college the first time around, you're trying to get a good grade, right? And when you take that time off and you see how the real world functions, and you realize that you want this to be your job or your career or your passion, you approach it different. It doesn't matter what the grade is. What matters is you understanding it and commanding the information so that you can become an expert in this, right? And so that's what the time off did for me. But obviously you have to balance that with, your age and your goals in life. So, Dr. Langer, you have kids. What do they think about this?
About what? What they want to do with them?
No, about college being rushed, or about getting the grade, or how do you guide them through getting the grade?
Well, I was just the opposite. I have a much different view on this. I think that there's no end. Everyone's looking to get through something or to finish. You're never really done. I mean, just because you graduate, there's always some other thing. And to try to shorten it just to get done more quickly, you're never done. I mean, it's just a giant continuum. It's the way you think about time, I think. And it didn't come to me early on, but, I took off a year after college. I spent a year in England. And then when I came back, I did extra year in medical school of research. And then even I did a fellowship after residency. And then I did it 10 years later. I did another fellowship. You have to take your lumps sometimes. And,
I think that needs to be enforced though to kids going through it, and especially people listening. It's not a sprint, right? No. At all. It's ongoing.
Like, I think the worst thing you could do is a 6-year medical program. I just don't see the value that often the smartest, most hardworking, ambitious, in some ways, sometimes the less confident kids are going to rush and do that. I just don't think it's a good idea. If you're smart enough to, get into a 6-year med program, you're going to do fine. You take the MCAT, it's okay. It's not that big of a deal.
Yeah.
It seems at the time it is, but you don't want to. I think accelerating your way through it denies you of some of the sort of the kind of color and the variety of life. If you rush everything and be the youngest, the youngest medical students aren't the happiest. There's not. There are these crazy superstar, brilliant kids that do college in 2 years and then go to medical school when they're 18, whatever. At least in the U.S., it's just nuts. And I don't think that you can socialize well. I think there's a lot to be said about having other experiences. And like you said, the grades are irrelevant. No one's graded as a doctor. And
Yeah.
So all those things are important. Part of it becomes financial, though. Frankly, I mean, to take time off can be expensive. And
Yeah,
so
you
you don't have the means. You either have to get a scholarship money, or you have to work in a lab where you're getting paid. Ultimately, money dictates a lot of the variability of these sorts of things. My extra year in medical school, I had a scholarship for it. If my parents had to pay for it, I don't think I would have done that. It's a lot. But I would urge this group to, back off a little bit. It's not that you should back off hard work, just back off your expectation. You're never done. You're just never done. I continue to learn. I continue to challenge myself and progress. Right now I'm focused on not so much how many more cases I'm doing, but how to, help junior people be successful, how to grow a department. There are new challenges all the time, and it starts right now. Don't like stress about finishing, because those accelerated ideas make you anxious. They end up, creating, false finish lines. And, when I talked about stress in my first talk, there was the apocryphal story is that a general in Vietnam he was captured, his whole platoon was captured, or a lieutenant. And after he came out, after the war was over, his group had no PTSD. And there was a lot of PTSD and, prisoners of war. And they asked him why. He said, well, frankly, a lot of the guys that had PTSD, they're always waiting for the end. Like they were looking for signs that the war was going to be over soon, and they got excited about it. And then there were too many ups and downs. And, ultimately that's the reason why we didn't, is I just accepted this as the normal. Like we just got through it. We worked our way through it, and we just, when it was over, it was over. And when they came out, when it was over, they were more adjusted. And I think it's not totally, a metaphor for what you're going through, because you're not prisoners of war, but, just let it happen. Let it flow through you a little bit. Just do the work and you'll get there, and don't keep worrying about the end points all the time. I think that relieves some of the anxiety that you might have. That's my kind of way of looking at it, from obviously with my rear view mirror.
It's useful. I'm reading through some of the questions. We got a lot of going through.
I also just think that a lot of times people look into rushing the process, and they let quality suffer in that case, because it's important to take your time and make sure you have quality. I found for myself that if I was going to not take the gap year, I think a lot of the quality of my application would have suffered. I don't think I would have done as well in the MCAT. I think I would have struggled in the application process, because it's very time consuming. But now I've given myself the proper amount of time to turn in something that I'm proud of, and something that I think will represent me well to the med schools.
Yeah, I think that's right. Somebody just asked a question about post-backs. I think post-backs are awesome. If you knew you were going to do okay, I would just have majored in history or something kind of unrelated. Maybe do some of the medical school credits and then done a post-bac. And then you have this extra time to focus on those requirements. And then you have this other side of you that you can develop over time. I just think that's, to me, the best pathway. It's so funny, because in Europe, kids enter medical school at 18, and it's part of college, because the whole college experience in the European system is so different. You don't have the frats and the sports and the socialization that we do in the US. But the post-bac is kind of that transition point where you're just really doing the work that's related to medical school. And I love the environment, the post-bac kids, I think, do really well in medical school. So why don't I just cut out here? I'm going to cut out for 1 second. We'll come back. I just want to, I'm going to go check the operating room. I thought I might give you guys a quick view of the OR, and we'll come back to Josh. Let me just see what's going on in there today. I know we have 2 cases. I think we can do a little look in one of the rooms. Hold on, let me look. Yeah, let's take a look in here. Can you allow me to share my screen, guys?
You should be able to.
Have it, yeah. Your panel.
You cannot start screen share while the other participant is sharing.
Oh, sorry. That's
me.
All right, Josh, you fail. Sorry, I'm not going to write you. I'm not writing a recommendation.
Letter of no recommendation.
So we're looking in the OR now today. This is actually a typical OR setup. This is actually what's called we're doing an anterior lumbar interbody fusion. Dr. Baum is coming to the room right now. You met him in our spine series last week. So Griffin's scrubbing in here. This is Don. You may have seen Don in the Netflix intro. He's the guy who goes, "You're about to see where greatness begins." At the end of the trailer. This is a general vascular surgeon, Vikin Pamukian, who's doing the opening. This is a floor machine. We use these intraoperative X-ray machines to localize levels. The case we're doing today is what's called an anterior lumbar interbody fusion, where we identify the discs in the spine and but the great vessels are in the way. So Vicken is in there dissecting through the abdomen to access the spine through the abdomen, and then Griffin's going to come in and dissect those discs out and put some fusion grafts in. But you can see this is the typical setup. We have monitoring people back here that monitor the spinal nerve roots, the spinal cord. The anesthesiologist right here, this is Dr. Johansson, one of our anesthesiologists, Katie Johansson. This is Dr. Pamukian with his resident, 2 residents are working with him. And then Don is here as the scrub tech. We also have circulating nurses. Very often there are devices and instruments and things that are needed. So there needs to be a circulator that sort of walks around the OR and picks things off the shelf so that the surgeon doesn't get frustrated. See Griffin, that's a typical way you scrub in. He's got a headlight on. He's also wearing a GoPro today to do some video of the case. Griffin's a super tech guy. He has a headlight. You can see the headlight shining all over the room. I actually stopped using the headlight and loops. I like the exoscope. Unfortunately, the exoscope is being used in Dr. Ellis's room, which I'll glance at. We can actually go in there. So this is another room. This patient is getting ready. In this room, we're going to do an aneurysm. You can see the patient's in a head holder. This is the exoscope here. That's what it looks like in the room. This is the magnification and lighting portion. In this case here, the instruments, you can see this is the surgical chair. We cover it's all anything blue you don't touch because that's sterile. And now we're seeing some folks scrub in here. This is another anesthesiologist. There aren't quite as many people necessary in a craniotomy as a spine case, but you can see the anesthesiologist sort of goes in their cubby hole up here. And then the surgeons are at the head in a cranial case. This is one of our circulating nurses. Patient was just prepped, and then Dr. Ellis will come in and we will show you how they drape the case. So here comes Jason. Jason's our junior vascular attending. He has you can see he has loops on as well. So he just washed his hands, and now he'll put his PPE on, his personal protective equipment. This is a new Betty, I think. That's our chief PA, who's with Jason down there today. When you scrub, you're supposed to scrub from your hands to your elbows. You can see Jason so he did a good job. He's got some soap on his elbows, so we know he did a good job scrubbing. And then you'll see how we drape a case. The draping is actually one of the sort of most important things you learn very early on in surgery. See now that this tech is giving Jason his sterile gown. So Jason will put that on. There's a circulator behind him to tie his gown because he can't reach around and do it himself. And then you'll see how he puts gloves on it. It's convention to always put your right glove on first. Where I trained at UPenn, the chairman there was a guy named Ravden, who was crazy. He was totally intensive in the 1950s and 60s, and he was left-handed. And he basically forced all the scrub techs to put his left glove on first. So at UPenn, everybody puts their left glove on first, at least when I was a resident there. I don't know if it's changed, but he set that standard. So now you see Jason here with the new who's going to assist him today. I'll probably go down there and take a look in a little bit, and then you'll see how he drapes the case. Here's Darwin, another one of our circulating nurses. So Anu's going to put these blue towels around the surgical site. One of the things about surgery is that when it's all covered, you don't see anything other than the wound. It's not as sort of dramatic. It's one thing if the patient was uncovered completely. You kind of lose, you don't see the entire person. And that's why we do these timeouts, just to remind everyone this is, a person we're operating on, because sometimes you kind of just go in there and there's just like a little hole and you're just, okay, let's do something. So it is good to sort of stop for a second and note that. So Jay is now draping the feet. Here Anu's using a stapler that holds the drapes down. And now Jason's going to reach across the table. This is a down sheet, so you cover the chest. Here's the endotracheal tube for the breathing tube that that allows the ventilator to work. This is the ventilator back here and gives it. It's also anesthesia, so there's gas that's being delivered. Or you can do really 2 kinds of anesthesia we use in neurosurgery. There's inhalational anesthesia, which is the typical anesthesia. We also use IV anesthesia, which is called propofol. Propofol is a very heavy sedative. People know it as the Michael Jackson drug, because he used to use that to go to sleep, and that's what he unfortunately passed away from, a propofol overdose. But propofol can give us twilight anesthesia, can put people to sleep, really sedate them heavily. And so we use a combination of those two. Jason just put this sticky drape on top of the towels, and now it's very bright where that light is. You can see how bright the surgical lights are over that. That gives this reflective light that's makes photography in the OR so beautiful because it's just so much contrast and color. This is another sticky drape. This has a pouch on it. In any cranial case, any of the irrigation or blood that comes off of the field drains off the head. So we put a pouch that is going to be sort of right about here. You'll see it unfold, and then all the irrigation goes down into the pouch there, and then there's a suction tube that comes out of the pouch and goes to the wall. So that keeps the field dry. There's some garbage that was thrown over there by the scrub tech. And then once that's what's called the cranial drape, and they'll just peel that down towards the feet, which you're seeing them do now. I think they may leave the groins uncovered in case we have to do an angiogram during the surgery. This is the exoscope screen, so maybe at the end, I'm not sure if it'll be less than an hour that Jason will be using it, but the exoscope sort of comes in from this angle on the right, and this is the screen we're looking at during the surgery that with 3D glasses to look at the surgery three-dimensionally. So I thought
Someone just asked what music do we think they're listening to, and if it's Jason, it's 80s. It's an 80s playlist going wild.
I actually stopped listening to music. I used to use it. I find it to be distracting. You know, the trouble is I think the people around the room like it.
Yeah.
But there's a certain tone I like to set in the operating room. Look, if you're closing or I'm gone, it's fine, but I just don't find it to be very helpful. And so that's me. I mean, I've heard certainly classical music. I could hear, this is him draping the exoscopes. The exoscope needs a sterile drape. It's just a long condom drape. It sort of slides down over the exoscope. You can see that. And then he's going to click that scope drape right onto the end to keep this sterile, because we grab this and move it around so we can use it as a visualization device. Yeah, so music's, I don't think it's controversial. I don't have a problem people using it, but I don't listen to music in the operating room. When I was younger, I did. I just kind of stopped.
Yeah, Griff gave a talk the other day, and he talked about how he uses a podcast that's all like electronic music at 100 beats per minute or something like that. It's very Griffin.
I think classical music's kind of cool. Like guys who listen to jazz or classical music, I kind of like the feel in the OR of that. It's a little bit better. But anything that's kind of too beaty, or there's a certain flow you get into operating, and sometimes the music is just it creates dissonance. It's not where my brain is. I don't know. It's just me.
You got to hear your team too. So you really need, especially for certain, a skull-based case with monitoring, I like to listen to the heart rate as well as,
Exactly.
Beeps
it's eyes and ears. There's ears. You hear things. I definitely agree with that. You can hear the suction. You can hear the heart rate. You'll hear the bovie, the cautery tools.
Yeah.
Even sometimes you just pick little things up. You get all this information, and you have to operate with your ears too. I completely agree.
Yeah.
And if you put music on, I think that disturbs that other sense that you might not take advantage of. So you can see the exoscope screen is on now. It's just taking a video of the floor. But this is kind of what it looks like. Jay tends to bring in the exoscope just for the microsurgical part of the surgery. He'll do the opening just with loops and a headlight. I like to bring it in right from the beginning. You can see the bag there that the fluids will drain into really nicely at the top. And Jay's this is a Doro frame. This is a retractor system. It's like an erector set that we attach to allow we use retractors and things to hold the brain in position. Oh, actually, this is a crappy, what's this thing called? That arm?
It's a Layla bar.
I hate that thing. That thing sucks.
It's named after Yasser's wife, right?
The worst. Jay is so stubborn.
Since I came to you guys, I started using the tie down.
Man, I can't get him to do anything new. I mean, it's just torture.
That Doro is great though. The Doro frame is
amazing. The Doro is really good.
Or I'll do the tie down, and that's it.
So that's
funny.
let's back to the other room, see what's going on in room 5.
Just so everyone knows, the Layla bar is a form of it's a retraction bar. Basically, you can put fish hooks that attach to the scalp and pull it to the bar. So it's another hand basically you don't have.
Actually, Griffin left. He must have gotten. They must not be ready for him. Look at Don. Don's working his butt off.
It's
Back
awesome.
and forth. Any questions, guys? Let's go. I decided today, and you can ask questions for Josh also. This is Josh's moment. You know, he's single. I don't know what his sexual orientation is, but I'm not going to ask in this meeting. It doesn't make a difference.
I hope he's really single.
He's right.
It was the fantasy book thing.
But I just why don't we have? Are there questions up there? I'm not seeing it. Should I stop sharing my screen?
Yeah, there are questions though.
They just roll in so much. So does each surgeon get to decide what tools they use to do a surgery?
Yeah, I mean,
Absolutely.
for charge, right? I mean, I think honestly, I think one of the biggest things you go through is not so much how you when you train with all the attendings who train you, and you have to develop your own way of doing things. But then you're constantly. I always like changing and like trying new things. Some people don't, and there's no right answer. I mean, what's most important is the patient outcomes. But I think if you stick to the same instruments all the time, and you're going to miss the opportunity to be creative and maybe make yourself better. So, you know, I do think yes, the surgeon decides what instruments they use, and not everybody does things differently. You saw Jason. I would never use the Layla bar. I think that thing's a piece of crap. I stopped using that when I was a resident. Jeez, it's like 1970s neurosurgery in there.
That's how we learned it. There was another good one. You know, there's actually a bunch of people asking Josh how he got this opportunity. I think it's actually valuable for you to address, Josh.
Yeah.
So I think it leads to a key point about, you know, time off and you know, decisions that you make. So go ahead, tell everyone.
Yeah. So I first started off by shadowing at North Shore with Dr. Shaliff and a few of the other surgeons there as well, and they liked the work I did. They thought I did a good job there, which is why it's very important to take advantage of every opportunity you have. And I was then recommended to work with Dr. Bukvar. And through that, I interviewed with him, and then the team took me on.
So Dr. Bukvar just sent me a text. I just want to show this to you. This is all John's thinking about right now. I'm going to have to take the screen again, unfortunately. So John has this crazy idea that we should do this.
Oh no.
I don't know, dude. I don't know. What do you think? He wants to do like choreography and he wants to do a TikTok. This guy's insane.
They're into it.
I just had to show you. He just texted me. He's sending me Williams family TikToks.
It's so funny.
I guess once I come in, I'll have to start making TikToks with the group.
Oh yeah. This is going to be part of your job description.
You just sent me another one.
But actually, Josh, just to go back to you for a second, I think that the reason it's important. Oh dear. The reason it's important though to tell your story is because you know there's relationships you make, and so you know you call someone, you meet them, you do good work, and you create a relationship, and everyone knows other people, and those relationships go a long way still, you know, in the world. And so I think that's important. You know, people here are just asking, who should I talk to? Who should I talk to? Who should I talk to? Talk to everyone. Talk to anyone. You know, tell them what you're interested in.
Look, Josh did the right thing. You know, you identify a mentor. You know, and you find someone who we said this before, without help, you can do it. It's just harder. So sometimes you have to be a little pushy, but you have to find the right person too. And John happens to be a great mentor. It's a meaningful part of his life to help students. I know Randy feels the same way. So, you know, you got to find guys like that, and they have to be accessible. You know, my first time when I decided to be a neurosurgeon, I went to the neurosurgery offices, and I was told to make an appointment with this neurosurgeon who was going to be my mentor, a guy named Tom Generelli. to the time. I'm sitting in his waiting room for over an hour waiting to meet him. And then he cancels on me. Like his secretary says, he doesn't have time to meet with you. But okay. So I rescheduled. I come back a week later. It's same thing. I'm waiting. And when he finally walks in, he goes, Dr. David, I think you should really work with Dr. Flam. And he just, basically, that was all he told me. He wasn't the right guy. And then Flam became my mentor, and, he ended up hiring me. So, it's kind of luck sometimes, but you need some help, and John, I think Josh, by identifying John as to help him, that was a good decision.
Yeah. I mean, look, I sent a cold email to Jeff Bruce. I Googled neurosurgery New York City in 2012 and got his lab, and I sent just an email saying I was interested in brain tumor research. The guy never wrote me back. Sandra Connolly, I emailed about a month later after I started getting worried. He wrote me back in about 2 minutes with a project proposal, and I was about to do it, and Jeff Bruce wrote me back about 6 weeks later. And, I emailed Connolly back, and I was like, listen, thank you so much, but I'm really interested in brain tumors. And, the guy I originally emailed finally got back to me. And because they knew each other, he understood, but it all turned into a great, project. It turned into a great resource and mentorship for years. So
there have been some questions here about, I just saw one, frustration, bureaucracies, that's everywhere, It's frustrating, but it's just part of our business. It only gets worse. Probably the best time is when you're a medical student or resident, when you're just doing stuff. There's a certain element of it's still a job theoretically. We don't treat it that way, but you do have bureaucratic things you just have to do, medical legally to get paid. There's things that we don't love to do, but we just sort of have to do them. I don't really find them to be just part of not everything in life is fun, and it's not all. Kind of like their course you're going to do that, that don't matter. There's stuff you do that isn't necessarily related to your ultimate happiness. That's the way life is. Yeah. How did you reach the doctor you were shadowing, Josh?
My father actually was friends with him, and he reached out to my father and said, I'm interested in working with your son. I mean, that, it sounds like my parent helped, and it did, but it also was that he trusted me. He knew, I had to send him a resume. I had to send him my CV, and he saw and wanted to work with me, and he was interested. But
yeah, I mean, there's definitely Nell, this is one of the reasons why I think sometimes, culturally, when I think Randy and I have talked about this, of opening up to, if kids are first generation or coming from, less, privileged backgrounds, your access points are less. These kind of untold, inefficiencies in our system, that if your parents know somebody, they can make a phone call. There's nothing wrong with it. It's just, if you don't have that, then, you have to be a little more creative. But remember, that parent before him may have had that problem. So somewhere along the line, people were starting from zero, and we all stand on the shoulders of giants. We talk about that, as surgeons, we're only as good as the people before us that trained us. So if we're great, it means that somebody helped us along the way or taught us something. It's the same thing with this. I mean, you take advantage of the opportunities, don't complain about it, and you'll make progress, and then your kids will take advantage of it. That's just the way it is. It's the nature of the United States, and hopefully we continue this country that way. I hope so. Yeah. Randy, you're a first gen doctor, right?
Yeah, no, I was just going to chime in. I mean, I can only speak from experience, and I think that my folks, my mother didn't finish high school. I think my father finished high school, never went to college, just got a job. There's no physicians in my family. My aunt went to college. I'm the second one realistically to finish college, and I took time off afterwards. I didn't even go straight into medicine, and so I think that it was all about what I wanted to do, and more than anything, the most important thing that's been beneficial to me is pursuing what I want, and being, figure out a way to get what I want to happen, and then understand that it's not just, I can't expect it to happen. You have to do the work, And so I've always been buckle down and do what needs to be done to make it so. My relationships, like I said, that was a Google search and a cold email to a guy. And I just, sent him my CV at the time, which didn't have really much to do with medicine. I was a first year in medical school. And he took a chance, and that was great. But what I would say is that, you may not know doctors. You know, not everyone knows Chalif, right? Not everyone knows Dr. Chalif, but everyone has a doctor, all right? Or most people have access to doctors. And if you're interested, you call them and you say, hey, look, I'm interested in this and this, or I think I am. Can you recommend anyone? And if they don't, find another one and ask them. And so, you know, you got to be a little bit creative about it, but you also have to be, you know, resilient about it and push on.
One thing I will say, you know, somebody asked the question about DOs and neurosurgery. You know, it's not that you can't be a doctor and being a DO. In fact, there's some very good DO doctors, but at every step of the way, there are going to be thresholds. And if you don't do certain things, like starting with your MCAT score, your SAT, it doesn't mean if you don't get the top score on your MCAT or it doesn't mean you're not smart or can't get into medical school. But unfortunately, because when things are competitive, they use these things as thresholds. So if you get 1,000 applications and we can only interview or really look at 300, they're going to create a cutoff. It doesn't mean the 700 people that were rejected might not have been good. It just makes them more efficient. And so that the kids that are in that 300 kids that make it, on average, are likely to be a better fit than the on average. But there are kids on both sides that could have been in the other group. The trouble with the DO is you immediately put yourself at a disadvantage for the types of fields you want to go into. It's so difficult to match in some of the competitive fields, particularly radiology, dermatology, ophthalmology. If you're a DO, those are tough to match in good programs. And neurosurgery is just like that. And there are very few neurosurgery slots. There's only about, Randy, like 150 slots a year, something like that?
Yeah, it's small.
You know, and they're about every year, there's probably about 600 applicants. So, you know, if you're a DO, you just don't have the mentorship. You don't have the person making the phone call. You don't have the academic background. You just don't have the same mentors who are at the level that are influential. So I would, it's not that you shouldn't go to DO school, but if you really want to have all the opportunities open to you, and if you want to be a family practice doctor in the country and have like your own office and just take care of, general medicine, it probably doesn't make a difference. But if you really want to go to like the best training program and do something really cutting edge, that's really tough from a DO background. It's like having a low SAT score. It's going to eliminate your opportunities down the road. And the primary differences between the two have mostly to do with the depth of training and the research, and also who the teachers are and what their motivations are and how connected they are. And so when you go to DO school, they're just not as academic. They don't write as much. They're not as into research. They're not giving the talks at the national meetings. They're not in the journals. They're not as influential. So when you don't have people that are like that backing you up, you're at a disadvantage. It's, and that's just the way it is. And so I would argue, unless you absolutely have to go to DO school because of your grades, try to get to med school.
Hey, Dr. Langer, there's a lot of questions here, and I realize, I think we're all super pleased that this is now a global conference. A lot of people asking about foreign medical grads and getting into the U.S. for medicine. I mean, listen, I'm super proud of the U.S. medical system. I think we do fantastic work, fantastic research. I think we obviously push the envelope a lot. I don't have a ton of experience with this. I wonder if we should get, maybe some of our people on board who have done this, because we have people who have success stories, and get them to give a panel lecture about how they made it through.
I mean, I could get, Erez Nosek is a great example.
Yeah.
Amir Dadashti.
Yeah.
You can ask Amir.
Yeah. Deepak, and yeah, I think you want to do it on a chairman's corner. We can do it.
Yeah, that's fine. We can set it up on a Friday.
Yeah. I'll reach out today with Josh.
Yeah, that's a good idea. Just throw it. Next week we're having this Pamela Park, which you can post. Maybe we'll start putting that on social.
Yeah.
But guys, if you guys look up Pamela Park on social, maybe follow her. All you guys out there. I know she's on Twitter. I'm not sure if she's on Insta. She'll be here with us next week. Her Twitter handle, let me just give it to you, because that'd be nice to follow her ahead of time and read some of her stuff. Her Twitter feed is Dr. Pamela Park. Right now she has 136 followers, so let's crank that up to 1,000, please. Yeah, but everybody start following her. She was a founder of this North Star Leadership. I've read a lot about, what she's done, and I think she went to Harvard Business School. She's also a physician. I think she's super bright, and I think her way of thinking about leadership is really, really unique. She talks about the fact is a gold star leader is someone who always gets credit for things, that you're moving up the food chain. I did this, give me credit, and then you get promoted. And then and it's kind of the way we all, move up, in everything. It's the typical way is gold star, but a North Star leader has a vision. They're following a goal, and they surround themselves with people to make that goal a reality and build it based on their vision. And that's a different kind of leadership. And she'll talk about that. And I really believe that that's the future with IT, with social media. There's so much more you can do now as an individual, be influential and create a role for yourselves. And I think you'll really enjoy her talk next week. So please follow Pamela Park, and I'm going to watch this number bump up. If we don't bump that number from 262 to at least 500, I'm canceling the rest of this course.
Say the handle again. Maybe we can put it in the chat or something.
Dr. Pamela Park, all one word.
I stopped the chat for a sec so everyone can take a look real quick and go follow her.
You mean to type it in?
I got it. I
Josh did it already. What's it on?
She's gonna be very confused when she checks her Twitter.
It's all of a sudden it's going to jack. I'm going to tell her right now we're doing it.
Yeah, we'll let people. I'm trying to do it right now too.
$336 already.
I should do this for mine. All right, I found her.
Okay, she'll wake up. She lives in California. She's gonna wake up. It's like, what the hell happened? No, but this is great, Josh. I think. So, what do you now that you've been? I mean, some people are asking us about shadowing, and the problem is it's all we can't let anybody in the hospital yet. They're just not opening it up. So, Josh really is taking advantage of the virtual nature of this. Josh, do you see this something that we could do sort of two sides to it? How would you envision this maybe next summer?
The program?
Yeah.
I see this as something, I think that even just these video cameras of the OR right here would be incredible to use more often. I think the fact that we have so much reach now, and we have, over 12,000 people registered for this program, we have a very unique opportunity to reach populations that we couldn't before. And I would love to continue this type of program, and hopefully the country will be open and start bringing lots of people into the hospital. But unfortunately, it's even been very difficult for me to get in the hospital right now.
I got to be honest with you. There's no going back from this.
No, I mean, we're going to do this again next summer. We'll do it again next summer. I mean, we probably have, there's Vicken leaving the OR now. He's done. And now Griffin's going to come in. I think Griffin's there. Here's Griffin over here.
Yeah. Everyone, they have their arms folded, not because they're angry. It's actually a way to protect your hands from.
They're going to do an x-ray. So what they've done is they've marked the spine with an instrument. So now they're going to bring this Flora machine in, which is an x-ray machine, because when you're doing spine surgery, the biggest way to screw up is being at the wrong level. All the discs kind of look the same, and you don't really, there's no way to know just visually exactly what level you're at. You're usually within one level, but if you're at the wrong level, that's medical legally a bad idea to take the wrong disc out. So we always have to mark the level. So what we've done, they put a little metal spike in the disc space, and they're standing behind this screen that's basically blocks X-rays, and then they're going to do this view of the spine. This is it's called the Zeem. It's a fluoroscopic machine to do an intraoperative X-ray, and see, now they'll flip it around because you want to get a lateral view. You see him flipping it around, and we have to keep everything sterile, so it's a sterile sheet on top here, and he's going to do this X-ray, and the image is going to be on this side. Unfortunately, you're not going to be able to see it, but that's okay. He's looking there at the screen now to see whether it's centered. And then Griffin will go look at the screen and make sure they're at the right level. This is a L45, L5S1 fusion anteriorly. I was supposed to be doing this, but Griffin's going to be working with me today.
I just sent one of these to Griffin too. It's a revision.
See, they're looking at the screen, making sure they're at the right level. Now Griff's going to come back in, and everyone will come back in. Vicken's holding his hands a little bit low. You should always keep your arms up on your chest, theoretically. That's not good technique. Oh, this guy right here with the red cap, this is a little bit controversial. Anybody who's a rep, we bring reps in from the equipment companies because they can help us choose the screw, the size. This guy, Mark Brandt, happens to be, and this is actually a reasonable career for those of you who are like, I'm not sure if I want to be a doctor. These guys do very well financially, and they're in the OR every day, and they work very closely with us. Mark is probably the best rep we've ever worked with. He's super knowledgeable about spine. What he does is look at him. He's checking the x-ray. We like reps that do that. He's going over, he's looking at it. He's going to give us feedback. And all this equipment on the back tray, these are all these equipment trays. There are lots of different instruments. And what happens is when we're operating, we kind of want to choose a particular device or a size. And Mark can point out, to Don, what instruments to pull, what implant to check. And Mark is so knowledgeable. He gives us so much feedback about the which things to use. And having a good rep in a spine case is just so important. So we really protect our relationships with our reps, and that really helps. Randy, there's a question about talking about debt, burnout, mental health.
Yeah, I saw it. I think it's a great question. Burnout is very real, but transient, right? I think, it depends how you are as a person. I'm generally a pretty positive person about things. I think you feel burnout starting in college, right? You feel it in college, you feel it in residency, you feel it in med school, obviously. And the key to dealing with burnout, at least for me, is to stay focused on your end game, and to take that time that you need to, whatever you need to figure it out. Whether it's a little break, a weekend, an hour, be open and honest with people about what you need and what you need to do. Again, the reason I say it's transient is because there's going to be periods where things move, and there's going to be a day where you just get a good night's sleep and you wake up and you're back into the flow, and you're ready to rock and roll again. That's kind of the way I think about it. Mental health as a doctor in residence, there's, again, it's about your framework, your frame of mind when you look at these things. I obviously, I treat cancer. That's what I enjoy treating. That's where my passion lies, both in surgery, but also from like the research end of things. And treating cancer is terrible, right? Right now, we don't have a cure for cancer, for a lot of cancers, and people die. And so you do all this work and you develop relationships with people, and then they ultimately succumb to a disease that, you did your best at. And that's not necessarily failure as much as it's, just, it is what it is. And, we're trying and we're learning. And so it's how you frame your mind about things and the perspective you take when you look at, treatments and whatnot. Debt is a real issue. I don't know how to deal with it yet. I'll figure it out and then I'll tell you guys next summer.
I think burnout is self-imposed.
Yeah.
And it comes from having unrealistic expectations. It comes from not taking care of yourself and worrying about what other people are thinking and looking at other people. That's what burnout is. Because look, we all work hard. If you're not doing what you like to do, then you should be doing something else. It's as simple as that. So the first thing is choose the right job for yourself. Don't do it because your parents want you to do it, or it's cool. You think it's cool and it would be cool for people to see me doing this, or my friends told me to do this, or this guy who said I should do this. Forget it. You have to, whatever you choose to do, the first decision isn't medical school, actually. It's like, what kind of doctor you want to be. And don't do it based on money or, my feeling is it always had to be, you see someone doing something that you really think you'd like to do. And you meet that person, you get to know them, and if something resonates with you about it, and then you continue to study it, and then that's when you commit. And usually that works out. It doesn't always work out, but usually that works out. So the first thing is choose something you like to do. But if you're doing that, then you got to just focus on yourself to just do the best you can do. Stop looking at other people. Make yourself the best you can be. And then get rest. Take care of yourself. If you're tired, I'm taking next week off. I'm freaking exhausted. I just said, you know what? I'm out of here. I can do that. But, the truth is you need to rest. You need to get exercise. You need to make sure you eat well. I drink too much, but I try not to drink too much. It's just that we go across the street and I get a martini. That's the way it is. I mean, the truth is that ultimately you're in control of burnout. And if you're feeling tired and you're feeling like it's not for you, then change your focus, change the types of things that, you can do. I agree. Alcoholism is a problem. Someone brought that up. And I think you have to be very careful how much you drink and how much and drugs also can be a problem. I'm just have a call. You can pick up on that, Randy.
Yeah. Listen, I agree with everything Dr. Langer said. And the main thing about the drugs and alcohol problem is, obviously, staying focused on your job and taking care of yourself in other ways before you fall into that. It's a slippery slope, obviously. I think, we could have a whole summer seminar series about, problems with addiction and issues like that.
Hey guys, I got one of the vascular surgeons needs me in the OR to take a look at an angiogram. They have an issue with a subclavian or something.
I'll finish this question. Yeah. And then we'll get out of here.
Take it up and I'll be back next week and we'll have Pamela on. Hey guys, as of right now, I only see 477. We got to break the 500 mark. We need 3 more people signing up on Twitter. I'll stop sharing.
Sounds good, man.
Take care.
See you later. I'll wrap it up over here.
Okay.
But actually, burnout, I haven't had a day off now since February because of COVID and then afterwards. And, I've been on call every day, every weekend. And so, you get tired, but the nice thing is there's systems in place. You have home call and, you have support within the hospital system. You just taking care of yourself is first and foremost. And I think it actually goes back to this idea of everything being rushed. You have time. All right. You have time every day. You just got to force it. You got to make it. Right. And so it's okay to stop and close the door and sit down and take the 5 minutes and, do the mindful moment that John Bookpark talks about all the time. And that's going to benefit you. All right. Usually what happens at the end of the day, like right now, I have 3 people in the clinic. I got to go see a patient too. The timing on here is perfect. 4 people in the clinic. I'm going to sprint for the rest of the day. When I'm done at whatever time it's going to be, I'm going to go home, and I do this pretty much every day. I live, right next to Central Park. I'm going to sit on a park bench, even though I'm home, and I'm not going to go inside until I take, 10 deep breaths and just relax myself. Because if I go in all wound up, it's just not good for anyone. It's not good for me. It's not good for my family. And so, you got to take that minute. And so anyway, you guys, we're going to break 5 minutes.
Can I speak a moment to that as well?
Yeah, go ahead.
So I'm currently a crisis counselor. If you're ever in a crisis, please feel free to reach out and text the crisis text line. But the one thing I think I've found a lot is that people are just looking for a support system. That's why a lot of people reach out to us. They want someone to talk to. So make sure you make those connections with people in life that will be there for you and give you good advice and just help you relax, because just talking with someone, sitting down, taking a moment to think about what the real problem is, because it becomes very overwhelming, but someone will help ground you and help you think about what's really important and what you can actually handle. You can't stress about everything. You can't control everything. So focus on controlling the things that you can.
I like it. All right, guys. We got 5 minutes till the med students come on. Josh, I'm going to leave you with everyone.
Yep, they're here already, so I'll promote them and get them set up.
Great. They can get started. They can run whatever time they want. We'll see you all next week. All right. We've got great sessions. As usual, every single day. And more info to come on getting some brain turn swag. We're working on it, mile a minute. So enjoy your weekends, everyone, and don't burn out.